Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for joining me today. I want to give you helpful, useful, and real information. Once again, the disclaimer is in the description below. I want to make sure you understand the purpose of these videos, and I want you to be safe. In addition, there are links in the description to help you understand what products I support in order to help you with your recovery, and it greatly helps the channel a great deal. So let's get on with today's video, okay? Why the different format? Well, you guys have been asking for diagrams and pictures, and I'm gonna deliver today. So I'm going to try for the very first time some picture-in-picture stuff. So I want to use a computer to draw, and then also use this camera to, film my face. So I'm going to go down back and forth between the screen and the camera here, so that I can talk to you and you can see me as I go through it, and it doesn't become so boring. All right. What's the question today? The question is, what is a superficial anal fistula? What's the treatment, and what's the whole deal behind it? And that is an excellent question. I'm telling you, you guys know how to ask really good questions. So I'm going to explain that to you now. And I think we need to go to the drawing board. Okay, so please bear with me. My drawings are really terrible, but here we go. Okay, so I've got my pen here, and I'm gonna draw with, let's draw with black, because that's where we should start. And I want to give an overview about an anal fistula in that picture form first, before we go into what is a superficial anal fistula, because that is a type of anal fistula, okay? So if we were to draw the bottom end here, okay? So I'm drawing the anus with that straight line, and here's another straight line, and the curved line here, these are the buttocks. This is the anal canal, which is about 3 to 5 centimeters long. And then on top of this anus is the intestine, okay? Again, please use your imagination. My drawings are terrible. Anyway, we know that anal fistulas come from, or they start from, an anal gland. And these anal glands are closer to the outside of the anus, but we have many of these actually. Usually about anywhere from 10 to 20 or so. One of these, or excuse me, what's the function of these guys? They produce mucus. But when they get clogged up, they get the product, the mucus gets backed up and turns into a big bag. They're trying to release it, but the door for the outside is blocked. So what happens is that you get a little bit of a swelling with some fluid in it, and then this gets infected. There is a lot of bacteria in the stool here, and it's very similar to a pimple on your face. So this gets infected, and what does an infection do that can't be released is that it grows, okay? And so let me switch the color here, because we want to kind of say there's a problem here. So this redness is the abscess. It grows. Each day it grows bigger, and it grows much more painful till it typically reaches the skin. And when there's a problem, not just pain, but the skin is getting harder. It's getting boggy, getting more what we call edema, but that is really a sign of inflammation. It becomes difficult to sit on it, and then what happens? You hope that it pops by itself like a pimple would, and then the pus and everything drains out, okay? If it doesn't drain out by itself, eventually the pain will probably get so bad, or you'll be so anxious about it, that you'll see a surgeon like me or a doctor. Hopefully it's a specialist that can, oops, I touched the mic, sorry. Hopefully it's a specialist that can be an expert on the bottom end so that they can safely drain this and let the pus out. Okay, so what happens? You got over the first stage, the infection is gone, but the story doesn't end there, because where does the fistula come in? Well, based on our knowledge, 50% of people that had an infection in the bottom end will heal it like nothing ever happened. Okay? It will just disappear. Sort of like this, you go back to normal. All the inflammation, it completely disappears. There's no hole, there's no scar, it looks perfect. What about the other 50%? Well, the other 50% develop what's called an anal fistula, which is that tunnel like I've referred to in different videos. So let me draw a bigger bottom end so that we can get really, really detailed. So let's clear this drawing, and then let's make our bottom end huge. So the anus now is going to be very wide, and the buttocks here are much bigger. Okay, so buttocks here, like that, and your intestines on top again. All right, please use your imagination, I'm sorry. But one thing I want to draw in this picture are the anus muscles, or the anus sphincter muscles. That's what helps you have control, squeezing closed shut. There is an internal muscle, which I'll draw like this, because there really are like a circle around your bottom end. And then there's also an external, an outside muscle that you also have. The gland that we were talking about before, we'll take that guy as our example. So, if you get a fistula, there are many ways or multiple possibilities of where that tunnel can go. All right, and then we'll draw it in red for the tunnel here. But typically, what the story is that the tunnel will start from the gland, the inside of the anus here, and then it ends usually where the hole was, where the pocket of infection ended up. So I'm going to draw this guy here, okay? This is where the outside hole is. Now, what does superficial mean, okay? Superficial means that the tunnel is superficial to the skin or the outside of the anus, which means it's very close to the outside skin. So one example would be here. Let's draw that better. Would be here. And this superficial meaning specifically is talking about with respect to the anus muscles, okay? If it does not go through the anus muscle, that is technically a superficial anal fistula. And what do we do? What's the common treatment for an superficial anal fistula? The treatment is typically anal fistulotomy, okay? The fistulotomy means fistula, the tunnel. Otomy means open up. So what we do is we find this tunnel in surgery, and we essentially open up all of this skin here. This skin disappears. Okay, we open this up, and what happens is this tunnel is now in front of our face. We've splayed the skin open, and now we're looking and we can see the tunnel. So if I were to draw that a different way here, because I don't have an eraser on this for some reason, if the fistula was this red line here, same as this, but we're looking at it directly head on, the skin, since we cut it open, is now on the sides. Okay? And so you got the fat from the skin here, but you can see that before you could not see the tunnel. It would be all just skin, but when you cut open the tunnel, you got the edges of the skin on the side, and you're looking straight at the fistula tunnel right here. And so if you're looking straight at it, you'd say there's the inside hole, and then you can say that if you opened it up completely, here's the inside hole. And you can see that tunnel going from beginning to end. And this then would be a wound that you could heal, and it actually has the best chances of getting rid of it completely and having it not come back. It's about 95 to 100%. Okay, if you get a superficial anal fistula, thank your lucky stars, because that is the simpler one. It has the best chance of success. So if you got that one, congrats to you. Pat yourself on the back. That's wonderful. But going back to our drawing here, so what's not a superficial then, right? So I know that there's more different types. And I'm going to draw these in blue, but really the tunnel can go wherever it wants to. Okay, it can go through it like this, just one of them. It can go through both of them like this. Typically, if it goes through both, the hole is out here more, but I'm just going to keep things consistent. Sometimes it can go above, sometimes it can go above, and out like this. It's totally, it's really, your imagination can run wild. But there are more common types than anything, but really surgeons need to be careful with anal fistulas because we want to identify the original tunnel. We don't want to make more tunnels by accident. And so you have to be careful and be so that you don't destroy or create a bigger problem, really. But that's for a different video, in my opinion. So to answer the question here, what is a superficial anal fistula? Superficial anal fistula is one that does not go through any anal sphincter muscle and ends up being very close to underneath the skin here. And the treatment for a superficial anal fistula is fistulotomy, and it's really an excellent success rate. Yeah, and I think that answers the question right there. And I hope this video has helped you. Let me know in the comments whether you like this format or not. Again, I'm trying it out for the first time, and so hopefully this helps you conceptualize things better. I'm sorry, my artistry skills are terrible, but thank you so much for spending your time with me, and I wish you the best. Take care. Bye-bye.